Good morning, all. Today we will be presenting our personalized medication passport. Our goal is to improve medication adherence among adults who are managing multiple medications. Take a moment to reflect. How often have you encountered a patient and had questions about their medications? How many times were you faced with, "You should have it all in your system," or "I take it when I feel sick"? How many other encounters did you face where the patient didn't even speak or read in English, or simply was overwhelmed by the amount of medications? Every person in our group faced at least one of these circumstances. We recognized that polypharmacy, defined as more than 5 medications, was common in adults, and we decided to choose a medication passport to help combat these issues.
Okay, so we looked at some research that focused on medication non-adherence among patients with chronic diseases and multimorbidity. So research found that about 42.6% of patients living with multiple chronic conditions don't take their medications as prescribed. So this increases the risk for preventable complications. We also found that one in five new prescriptions are never filled, and among those that are filled, roughly about 50% are taken incorrectly in terms of timing and dosage. We did find a framework for understanding why patients fail to follow their medication regimens. And one of them is looking at patient provider interaction. So sometimes when communication is poor, then patients leave our offices not fully understanding their disease and how to take their medications. Second, there's patient healthcare system interaction. So even motivated patients may face structural barriers, right? So like difficulty accessing a pharmacy, high medication costs, missed appointments. And third is looking at provider system interaction. So we as clinicians frequently lack real-time knowledge of drug costs. So sometimes we may unknowingly prescribe medications that our patients can't afford.
Thank you, Ashley, for that information. Now I'll be discussing our intervention implementation. Our intervention is a centralized medical snapshot, also referred to as a medical passport. This tool is designed to give patients a clear, organized summary of their medications. It includes the names of each medication, their specific purpose, and specific dosing instructions, such as morning and evening schedules. Additionally, it provides helpful notes, for example, reminding patients that medications like metformin should be taken with meals. The goal of this tool is to simplify complex medication regimens and improve patient understanding, adherence, and overall health outcomes. This intervention was implemented at Zacualco Medical Group in Bakersfield, California, which served a diverse patient population, including many Spanish-speaking individuals. Now, how was all of this carried out? So first, the medical passports were created in both English and Spanish to ensure accessibility and culturally competent care. While patients were waiting to be seen by their provider, a physician assistant student distributed a pre-test survey in the patient's preferred language. The survey assessed their baseline understanding of their medications. Next, the PA student worked one-on-one with the patient to complete their medical passport in their native language. This step is key as it allowed for patient education, patient clarification, and engagement in real time. So finally, about 3 weeks later, the PA student conducted a telehealth follow-up visit, again in the patient's preferred language, and administered a post-test survey to evaluate improvements in understanding and adherence. So overall, the goal of this intervention is to empower patients to take an active role in managing their health, ultimately helping them live healthier, more confident lives. Next, I'll be discussing how our intervention incorporates health literacy, cultural humility, and trauma-informed care principles, along with key equity and inclusion considerations. Starting with health literacy, our approach prioritizes communication by using plain, non-medical language so patients can easily understand their medications and instructions. The medical passport is designed with a simple layout and visual aids, such as symbols to represent different types of medications. For instance, a heart symbol for cardiovascular medication. We also provide verbal step-by-step instructions to guide patients through their medication regimen. Most importantly, we use the teach-back method, where patients explain the information in their own words back to us. This helps us confirm understanding and address any gaps immediately. Next, to cultural humility. We take a patient centered approach by asking patients about their individual beliefs and their health practices rather than making assumptions. This includes acknowledging home remedies that patients may already be using. So instead of correcting or dismissing these practices, we aim to collaborate with the patients, integrating their perspectives into the care plan whenever it is safe and appropriate, of course. This helps us build trust and strengthens the patient provider relationship. Hi, down here. Moving on to trauma informed care. We ensure a respectful and non judgmental environment, recognizing that patients may have had prior negative healthcare experiences, unfortunately. We emphasize patient choice and shared decision making, allowing patients to feel in control of their care. Additionally, we take time to explain the purpose of our questions and the overall goal of the intervention, which promotes transparency and reduces anxiety. Lastly, our equity and inclusion considerations. We recognize that barriers such as cost, transportation, and pharmacy access can significantly impact a patient's ability to adhere to treatment. We also consider language needs and varying levels of ability, ensuring that our intervention is accessible to all patients. Overall, these principles are essential to delivering care that is not only effective, but also respectful, inclusive, and empowering for every patient.
To evaluate our intervention, we used pre- and post-test surveys. These included Likert scale questions assessing medication understanding, confidence, organization, and communication with providers. This allowed us to measure changes after using the medication passport. The pre-test showed that participants already had a relatively strong self-reported understanding of their medications and were comfortable communicating with healthcare providers. In contrast, medication management behaviors were much weaker at baseline, especially keeping an updated medication list and bringing that list to their medical appointments. This suggests a knowledge-behavior gap where participants appeared to know what should be done but had not made that knowledge into consistent habits. We observed clear improvements across multiple areas after the intervention. Understanding of medications increased from 20% to 60%, and confidence in taking medications increased from 20% to 70%. We also saw a significant increase in patients keeping an updated medication list from 20% to 80%, and more patients began bringing their medication list to appointments. While communicating with providers slightly improved, one important finding was that feelings of being overwhelmed remained unchanged, highlighting an area for future improvement. Our findings suggest that improving medication understanding and organization can directly increase patient confidence and engagement. After using the medication passport, participants showed clear improvements in knowing what their medications are for, how to take them, and keeping an updated list. We also saw a slight improvement in communication with providers, which suggests the tool may help support more effective patient-provider interactions. However, despite these improvements, participants still reported feeling overwhelmed managing their medications. This indicates that while knowledge and organization improved, the overall complexity of managing multiple medications remains a challenge.
So the big question, were goals met? Yes. Findings from this project indicate that the medication passport intervention improved recall of medication, strengthened patient-provider communication, and has potential for long-term benefit. Several barriers were identified during the intervention. A change in the service area, time constraints during visits. Another factor was that certain participants were already enrolled in a home health program, which may have increased their baseline knowledge of their own medications. There were also several limitations. The small sample size limited variability. The short duration prevented assessment of long-term outcomes. There's also potential bias due to reliance on self-reported questionnaires, which may not accurately reflect true understanding or behavior. Several solutions were proposed. We collaborated with a new clinic that had a similar patient population, and clear exclusion criteria was considered to better define the study population. To strengthen findings, extending the duration and increasing sample size were recommended. Integrating the intervention into the electronic medical record system could improve continuity. Additionally, implementing brief staff training may enhance consistency in the delivery. Survey improvements were also suggested, including adding a question to assess whether patients plan to continue bringing or updating their lists. Finally, replacing the current Likert scale with a numeric scale from 1 to 10 may provide more precise measurements of responses.
So next, I'll be discussing our star wish for the intervention. Our first star was just how simple the intervention was, and we believe is one of our greatest strengths. Patients can easily identify their medication name, what it was used for, the dosing schedule, and any additional notes implemented by the provider or the patient themselves. It also supports healthcare providers in a time-sensitive situation by reducing the risk of misunderstanding. Our second star was its portability and accessibility. Because the medication passport can be carried away easily, patients are able to share accurate medication information across different healthcare settings. In fact, it was just a piece of paper and it was slipped into a plastic protector. And lastly, an area of improvement. We believe that a section for tracking changes for medications over time would be necessary. This would allow patients and providers to easily see when a medication was started, adjusted, or stopped in order to help prevent confusion and improve overall continuity of care.
To wrap up, our project shows that even a simple patient-centered tool like the medication passport can significantly improve how patients understand and manage their medications. We saw clear improvements in knowledge, confidence, and organization, highlighting that better outcomes often come from making care more clear and accessible, not more complex. Because of its simplicity, this model can be easily implemented in primary care settings to better support patients managing multiple medications. Thank you all for your time and attention. We'd be happy to answer any and all questions.